I learned about memory loss and the diseases that take your memory, it became painfully apparent that it was a devastating disease for the entire community, but a much heavier burden on communities of color. And that was an interest of mine, narrowing the disparities gap. What can we do to make sure that people who might not have the best access to healthcare or might not even trust healthcare enough to get in and take care of themselves, how do you keep that group from suffering disproportionately from these diseases?
Yeah, we do know that African Americans tend to be diagnosed with dementia a little bit later in the course as compared to Caucasians. And that's, I think, because of a number of reasons. One of them is probably mistrust of the healthcare system. People talk a little bit about what happened with Tuskegee, but there are also discussions about, grave diggers pulling up the bones of slaves and trying to learn anatomy on them, or taking slaves into the operating room without anesthesia and practicing surgical techniques. And so there's a history of mistrust, certainly, but there's unfortunately still ongoing issues with the healthcare system as it relates to African Americans. And I think that has led African Americans to be a little leery of the healthcare system, understandably. And really, our role is to tell our African American patients and their caregivers that there are benefits to really seeking support early and seeking early intervention and evaluation, particularly if there's a concern for dementia.
The way that Alzheimer's disease works is that 20 years before people develop Alzheimer's symptoms, a protein is deposited in the brain called the amyloid protein. And we can detect that amyloid protein before people become symptomatic, many years before they become symptomatic.
So I say to people that dementia is really a family affair. It's not just the grandmother that has dementia, but it's the children that are taking care of the grandmother. It's the grandchildren that are watching the grandmother progress as well. And so we want to provide education to the whole family so that everybody knows and understands what this is, but also so that the younger generation can recognize it, because they can help reduce some of that self-navigation that often happens in the African American community, where people are trying to figure out, do I need to be evaluated or not? And many times the younger generation can tell something is different with grandma than it used to be, and they can help encourage loved ones to go get evaluated.
Some of the most important work was them figuring out what was a normal memory and what wasn't a normal memory. Because if you don't know what the normal is, it's hard to figure out what the abnormal is. And one of my colleagues approached me about how difficult it was to even get normal Black people, people of color, poor people, no matter what their color, to participate so that they could figure out what is the normal memory in this group of people. But it was a lot of work to overcome, I will say, 300, maybe 400 years of bad stuff that had happened to people of color and poor people all around the country.
There's always one region or one health association, like in our instance, it's Mayo Clinic, that someone should find in their own region or their own community. Who is there that's helping? Who's there that's dealing with Alzheimer's? Who can you reach out to? And for us, Mayo is doing a huge service in our African American community to try to help with Alzheimer's.
We also do imaging studies. We do MRI scans of the brain looking at the structure, and we do what we call PET studies, or positron emission tomography. Those are the ways, the PET studies are the ways we can see if there's amyloid deposited in the brain, and another protein called the tau protein. And so those are often offered to our volunteers if they're interested in taking part in those studies, so they might know that they're at risk and maybe they would like to take part in a study once they find out such a thing.
And rather than wait like I did and deny it too long, we need to get on this now and spread this all over Black America. This ought to be something everyone running for office ought to be committed to resources on Alzheimer's disease and research. This is something that people of all races and economic backgrounds and educational backgrounds can unite around, because this is not something you can see coming.
I learned about memory loss and the diseases that take your memory. It became painfully apparent that it was a devastating disease for the entire community, but a much heavier burden on communities of color. And that was an interest of mine, narrowing the disparities gap. You know, what can we do to make sure that people who might not have the best access to healthcare or might not even trust healthcare enough to get in and take care of themselves, how do you keep that group from suffering disproportionately from these diseases?
Yeah, we do know that African Americans tend to be diagnosed with dementia a little bit later in the course as compared to Caucasians. And that's, I think, because of a number of reasons. One of them is probably mistrust of the healthcare system. You know, people talk a little bit about what happened with Tuskegee, but there are also discussions about, you know, grave diggers pulling up the bones of slaves and trying to learn anatomy on them, or taking slaves into the operating room without anesthesia and practicing surgical techniques. And so there's a history of mistrust, certainly, but there's unfortunately still ongoing issues with the healthcare system as it relates to African Americans. And I think that has led African Americans to be a little leery of the healthcare system, understandably. And really, our role is to tell our African American patients and their caregivers that there are benefits to really seeking support early and seeking early intervention and evaluation, particularly if there's a concern for dementia.
The way that Alzheimer's disease works is that 20 years before people develop Alzheimer's symptoms, a protein is deposited in the brain called the amyloid protein. And we can detect that amyloid protein before people become symptomatic, many years before they become symptomatic.
So I say to people that dementia is really a family affair. It's not just the grandmother that has dementia, but it's the children that are taking care of the grandmother. It's the grandchildren that are watching the grandmother progress as well. And so we want to provide education to the whole family so that everybody knows and understands what this is, but also so that the younger generation can recognize it, because they can help reduce some of that self-navigation that often happens in the African American community, where people are trying to figure out, do I need to be evaluated or not? And many times the younger generation can tell something is different with grandma than it used to be, and they can help encourage loved ones to go get evaluated.
Some of the most important work was them figuring out what was a normal memory and what wasn't a normal memory. Because if you don't know what the normal is, it's hard to figure out what the abnormal is. And one of my colleagues approached me about how difficult it was to even get normal Black people, people of color, poor people, no matter what their color, to participate so that they could figure out what is the normal memory in this group of people. But it was a lot of work to overcome, I will say, 300, maybe 400 years of bad stuff that had happened to people of color and poor people all around the country.
There's always one region or one health association, like in our instance, it's Mayo Clinic, that someone should find in their own region or their own community. Who is there that's helping? Who's there that's dealing with Alzheimer's? Who can you reach out to? And, you know, for us, Mayo is doing a huge service in our African American community to try to help with Alzheimer's.
We also do imaging studies. We do MRI scans of the brain looking at the structure, and we do what we call PET studies, or positron emission tomography. Those are the ways, the PET studies are the ways we can see if there's amyloid deposited in the brain, and another protein called the tau protein. And so those are often offered to our volunteers if they're interested in taking part in those studies, so they might know that they're at risk and maybe they would like to take part in a study once they find out such a thing.
And rather than wait like I did and deny it too long, we need to get on this now and spread this all over Black America. This ought to be something everyone running for office ought to be committed to resources on Alzheimer's disease and research. This is something that people of all races and economic backgrounds and educational backgrounds can unite around, because this is not something you can see coming.
I learned about memory loss and
First of all, let me say good morning to everyone that is here on this rainy and cloudy day. Thankful to all of you who have come out today. My name, for those who may not know, my name is Rudolph McKissick Jr. I am the lead pastor here at the Bethel Church, and we are honored to partner today in what is such an important discussion and subject. One of the key words you hear in the church oftentimes is stewardship. And unfortunately, in the church, stewardship is oftentimes encased only about money. But stewardship is about management. And one of the things that we have stewardship over is our body. It's so important, and especially in the African American community, there are so many challenges of health that affect us in ways that it does not necessarily affect other communities. Brain health is so important. There are many of us who may not, like me, did not know that name until I began hearing about the planning for this wonderful event. All I heard were the various names of brain challenges, but did not understand the reality of brain health. And so today is going to be very important, even for those who may be watching by way of stream. I would encourage you to share it on your social media if you are watching, to call up, because all of us know persons who are dealing with brain health challenges. And even if you aren't, it's like a muscle. Eventually, if you don't know how to take care of it, you will have some challenges. And so I'm thankful today to be partnering. We are with the Mayo Clinic Alzheimer's Research Center. And I also want to thank the team here at Bethel, Tan Mayhew, who is our chief director of operations. I can never remember that. And our daughter, pastor and our daughter, Jocelyn, who is now a brand ambassador for Mayo and for this particular research center, and our entire team, our audio, visual, and everyone. You know, I have to get all of that out the way as the pastor. So I want to thank all of them, and to this wonderful panel, we thank all of you for being here today for what we know will be a very informative and lucrative conversation. So once again, welcome. There's Tan right over there, who's going to lead us off. And once again, thank you to all who are here. Thank you to all who are watching. And let's keep our brains healthy. Welcome again.
testimony. In 2005, I was living in Dallas, Texas, as what I call living my best life. And I got a phone call from my sister saying my mother was acting strange. And I asked her, well, what do you mean strange? And she just started describing some behavior that was not like my mother at all. At that time, I was with one of my mentors, and she said, maybe she's going through menopause. My mother was 58 years old at the time. So I thought, okay, that's probably it. Everything's going to be okay. I came home for what I thought was going to be a couple of months to just figure out what was going on with my mother. That was 18 years ago, and I never went back. I relocated because we found out that at 58 years old, my mother was diagnosed with early stages of dementia. And my sister was getting married at that time. My other sister lived in Atlanta with her family, so I knew that I had to come home to help walk through this new way of life that we were living. I can say to you, we are blessed because, as I stated, it's been 18 years. And when my mother was diagnosed at 58, we were not promised 18 years. The information that we got was not as promising as the information that is given today, which is another reason why I'm so excited about this event. But I will also tell you that the information that you will get today, if my sisters and I had this in 2005, those early years would have been much more peaceful for us, less stressful, and not so defeating. So I'm excited to introduce this amazing panel to you. We have Dr. Richard White. We have Dr. Gregory Day. We have Miss Francine Parrott. And we have Mrs. Pamela Quarles. And I'm going to start out by asking each of you, and we'll start with you, Dr. White, if you can tell this audience, why is this subject so important to you?
Wonderful. Thank you, Ms. Mayhew. Thank you, everybody, for the wonderful invitation to be here. Bishop McKissick, it's an honor to be in your all's home here. Recognizing I'm a guest, I'm a fellow believer, and one of the reasons I'm here is because it's important to me. I have a passion for sharing medical knowledge. I think the more that we know, the more that we can do what Bishop McKissick said and steward our bodies, which is a God-given responsibility, I believe. I also, like Ms. Mayhew, have experienced family members who have had dementia. Unfortunately, recently we lost one of our dear family members to complications from an advanced dementia. And the other reason I think that I'm here is because when I think about the health inequities that we look at, the disparities in our country, and understand why they exist, because of forms of thoughts that have led to certain actions that have created infrastructures, created barriers for certain members of our country to experience worse health outcomes. When we do things like these forums where we're sharing information, empowering people, for me, it's really a form of pushback against those systems. It's a way that we can try to undo what has been done over centuries in our country. So I think that those are probably some of the main motivating factors that I'm here, and it's a pleasure to be with you and look forward to our morning.
Thank you. Same with you, Dr. Day. Why is this subject so important to you?
I can echo a lot of what Dr. White said. We all have many different connections to this disease, the things that we're talking about. We all have a brain, and so we all want to keep it healthy. So I've got personal connections to it, but I think unique to the role that I serve as a neurologist that primarily treats patients with dementia is I have a lot of patients and I have a lot of family members who ask me some really good questions. They're questions about how do we make this better? How do we slow this disease down and optimize function and independence? And then I get that next tough question. What does this mean for me or for my children? How do we prevent this disease from developing in the next generation? And so I think what this session means for me, it's an opportunity to do everything that we were just talking about here, to extend knowledge, to empower people at a point when you can make a decision that might keep you out of my clinic. Maybe we get to see each other in the research setting, which is still pretty amazing. And so I think that research is the way forward in getting solutions to this problem, and we have to do that together, working as a team. And so I'm here to make sure that everyone knows about the great work that's going on, the hope that there is for a future with a healthier brain and a lot less problems with dementia.
Thank you so much. And I'm going to refer to her as Miss Francine because during our meetings, all I ever heard was, Miss Francine does this, Miss. So it's an honor to meet you. But Miss Francine, if you can tell us, why is this so important to you?
Thanks, Tan. So one of the main reasons the work that I've done through most of my career, which is working with patients and families that do have some cognitive impairment, is that I grew up with a very tight-knit family. And I had the great opportunity of spending a lot of time with grandparents and aunts and uncles throughout my life. And I remember one thing about all was that they had so many wonderful stories to share. So through the work I've done with, again, primarily working with patients and families and teaching about cognitive health, changes in memory, when to worry about your memory, is that it's all about maintaining the best quality of life. And the best quality of life for all of us is when we take care of our bodies, our souls, and our brains. So when people would ask me, what happens? My husband, my wife, my neighbor, is developing memory problems. It's always been very important to me to explain to them, you have to find out why. You can't just say, oh, well, because there are many things that can cause problems with memory. Some of them we can fix with maybe just better diet, better nutrition, a little bit more exercise. Some we can't immediately fix, but we can still maintain the person's ability to have a strong quality of life. So it's been my mission over the years to help people find the path that works best for them. Thanks, and I look forward to talking to all of you later.
Thank you, Ms. Francine. And last but certainly not least, Ms. Pam, can you tell us why this is so important to you?
This is personal. It's very personal. I'm not a medical professional, but I am the daughter of two parents who were affected by Alzheimer's. And when I say two parents, my mother was diagnosed with it, but my father suffered because of her diagnosis. I like to say his heart was broken. And so in reality, there were two people that had to be cared for. So let me back up. For a number of years, I'd say back into about 1984, when my parents would come to visit, we were living here, they were living in New York. We'd say, Mom's getting forgetful, and we were in denial, major denial. Oh, well, we're moving back and forth, they're traveling, she gets forgetful. So we blew it off for a number of years. And then the aha moment for me was when we were on vacation one year, and we were in a vacation house, and she went to come out onto the deck, and had to move the sliding glass door. And she stood there and absolutely did not know what to do. So that put it in the category for me, because I had been in denial. My husband had been telling me for years, there's something wrong with your mom. And I'm, nah. So fast forward, I didn't know what to do. So you know, God puts you in places and you don't understand why sometimes, but it becomes apparent after the impact. I was in a board meeting in Jacksonville for an organization that I volunteered with, and at that point, there was also another person on the board who happened to be a radiologist at Mayo. And I said, hey, you know, I'm seeing this with my mom. He said, maybe she's getting Alzheimer's. I didn't even know what the word was. So fast forward, you know, when we broached it with my dad, and we'll cover this later, but we didn't talk for a couple of months because he didn't want to hear it, and the fact that I raised the fact that there was something wrong with my mom, and he was in major denial. But after we fast forward and finally, thank goodness for Mayo, got her in and got a really comprehensive diagnosis, and it came out that, yeah, she was in the earlier stages of Alzheimer's disease. Now, why this is really personal for me, my dad was a Tuskegee Airman, and he was used to overcoming anything, no matter what it was. As a matter of fact, he and a couple of Tuskegee buddies played at a golf course here in Jacksonville where there was a color barrier, and they said, we're playing, and they played, and that's how that golf course then became open to people of color. So that was his background. So the idea that he had a situation that he couldn't fix, it literally started to kill him. My dad was a Tuskegee Airman. He was also a pharmacist. My mother was a registered nurse. So they had some medical knowledge, and they wanted to make sure of two things: that they got the best quality of medical care, and that if they could do something to leave a legacy by getting involved in any kind of research to make someone else's life better, they would. So my dad predeceased my mother by about 3 years, and then when she died in 2002, we dedicated her brain for research to Mayo Clinic, and at that time, I believe it was one of the few brains of color that had been given for research purposes. So this is personal. I'd like to see whatever I can do through the journey that I have had to help make somebody else's life better. Because if it had not been for Mayo, yeah, I probably would have been in McClenny as an inpatient. So it helps to have a great medical resource that you can partner with, that has your back, that's willing to, that really has your best interest at heart. So it's personal.
Thank you, Ms. Pam.
As a member of the African American community, it is my duty and responsibility to make sure that our health needs are addressed. And right now, I participate in 2 studies. I'm a part of that same study that my mother was, now that I'm a senior. I am also a part of a small Bethel study to help diagnose heart condition and Alzheimer's. So I think if we're not part of the study, the medicines that are developed are not for us.
So you see that we have a very knowledgeable panel here today. And so let me tell you a little about how today is going to go. I'm going to ask each of the panel different questions that line up with how they walk in this path that we're dealing with. You will have opportunities to present questions. When you came in, you should have been given an index card. If you didn't get a card, raise your hand and one of our ushers will bring you a card. But you will submit your questions. When you finish, you'll just hold them up and someone will come and get it from you. Also, for our online viewers, you can submit questions online and we'll get those questions also. Now, of course, I won't get a chance to ask them all of your questions at the end, But any of the questions that do not get answered, we will have breakout sessions after this, and those 3 breakout sessions will be individual sessions that you can then ask your questions, or you'll have the opportunity to present that question directly to Mayo and get an email back with the answers to your questions. So let's get started. My first question is for Dr. White. Dr. White, what are some of the best ways to maintain good brain health and prevent memory decline? And also, are there things that we can do daily to keep a healthy brain?
Great. Ms. Mayhew, thank you for that question. I think that's a very important question, possibly one of the most important questions that we'll ask here this morning. Many of you I know Dr. Floyd Willis. He and I are both primary care doctors at Mayo Clinic. I'm trained as an internist and a pediatrician. He's trained as a family medicine physician, but he and I work in the primary care setting. So oftentimes we're tasked with helping patients to really stay healthy and what we can do to try to prevent disease, identifying risk factors for certain unhealthy outcomes and early detection of disease, a lot of the things that we do. So in terms of responding to that question of what we specifically can do to maintain our brains healthy, I like to tell people that it's important to keep in mind always that if something is unhealthy for your heart, likely it's going to also be unhealthy for your brain. And so I think we're in the culture that we're in, people are a lot more accustomed to hearing about what I need to do to keep my heart healthy, exercise, keeping my blood pressure at a healthy level, knowing and keeping my cholesterol at a healthy level. These are all things that are also very important for maintaining adequate brain health. Cardiovascular disease is a risk factor for dementia. Diabetes is a risk factor for dementia. High blood pressure or hypertension is a risk factor for dementia. So those, are things that can really be bedrocks for helping us to maintain good health. Also, a lot of us probably don't have very good sleep, so getting an adequate amount of sleep is something that we could do to keep our brains healthy. As we've all seen over these last 3 years, as we've come through the pandemic, a lot of us have suffered from mental health challenges, from social isolation. Those are also things that are really important to manage in terms of our brain health as well, managing stress. Lastly, I'll say that for maintaining our good brain health, avoiding excessive alcohol is another thing that we can do that's really important. And focusing on our mental health and also our spiritual health, I think, are some really important things. So exercise, sleeping enough, managing stress, managing our cardiovascular risk factors. When you think about the term exercise, a lot of times people think, well, does that mean I have to go out and get a gym membership at Bailey's or go to Planet Fitness? And that's definitely not the case. Even just going out and walking. The exercise experts recommend that we try to aim for about 150 minutes of what they call moderate to vigorous physical activity a week. So getting your heart rate up a little bit more than what it is, just walking around the house is probably a good goal or a good sort of target to try to reach at. But going for a brisk walk or going for even a leisurely walk on a regular basis, but trying to work towards 150 minutes, that equates to about 30 minutes during the regular work week, and resting on the weekends. It's something that I try to do. I definitely don't get that in every single day, but making it a goal. So staying active, staying connected socially, knowing our numbers, talking with your primary care doctor about your individual risk. I think those are all things we could do to maintain good brain health.
Okay, I have two follow-up questions to that, Dr. White. The first one is, are there certain foods that we can eat that will help us to maintain a healthy brain? And the second one is, what is excessive alcohol use? Like, are we talking 1 glass of wine a day, 1 a week? What falls into that category?
So
I'm asking for the people.
For the
not
people,
for me.
yes, I understand.
For the people.
You have a friend, right?
I have a friend that needs to know.
Right. So a healthy amount of alcohol, so it differs whether you're a man or a woman. For men, we don't recommend that men have more than 2 servings of alcohol a day. So less than 14 servings a week. And so a serving of alcohol would be like a 12-ounce can of beer, or 5 ounces of wine, or probably less than a few ounces of like a shot of something. I don't drink on a regular basis, but that's what I hear. For women, it would be no more than 1 serving of alcohol daily. Okay, so if you're going above that, you know, and also, you know, a lot of my patients come in and I ask them how much alcohol you're drinking, and they say, well, you know, I don't drink it all during the week, just on the weekends. And then they stop there. Okay, well, how much is that? You know, oh, well, I might go through half a case of beer and I was like, well, that's too much. You know, if you're having multiple glasses in a sitting, you know, then is considered excessive intake as well. As far as the diet side of things, a specific diet that has been shown to really be healthier, you know, most of the literature that looks at diet, you know, talks about the Mediterranean diet. There's all these fad diets that are out there. My nutritionist colleagues, when I ask them that question, they say that the best diet is one that you can stick to. You know, certainly avoiding excess, you know, fat in the diet, getting, you know, more, you know, avoiding really highly processed foods that are packaged, that are high in really refined types of sugars. You probably want to avoid those things. You know, but eating a balanced diet with fruits and vegetables, with whole grains, with lean protein, you know, that's probably a pretty healthy type of diet.
Thank you. And you all can thank me later for that alcohol question. Dr. Day, I've recently read that African Americans develop memory loss twice the rate of Caucasians. Is that true?
So your sources are good and accurate as we see it. And so we think that dementia, a form of memory loss that I think is progressive over time, that gets worse, that causes more and more problems in daily life and relates to changes in the brain, is twice as common in African Americans compared to white Americans, and about 1.5 times as common in Hispanic Latin Americans as compared to white Americans as well.
Is there a known reason for that?
Well, I'm going to answer that question with something that our medical professionals should probably say a lot more. We don't really know. That's the honest summary truth to that. I think that's how we should start that discussion, but there's a lot of potential contributors to that that are starting to be dissected through studies that happen at Mayo Clinic, happen throughout the United States. And I think what we do know from those studies, well, first off, it's not genetics. There's really not that much different about the makeups of the bodies of Americans or North Americans. I think, and the other part of it is that the challenges, what differentiate that risk, probably start really early in life. And again, that emphasizes and goes back to everything that we've just heard about how do we keep our brains healthy. Well, it probably starts in childhood. Increased exposure to environmental toxins, to increased stress, whether at home or simply in the community or in the school, the quality of education that's open and access to people and how that's sustained across generations creates a foundation for brain health. If there's problems with any of that, that may impact risk even decades later for things like memory loss and dementia. That continues through midlife, and it's in midlife where we think that all the work that happens with your family doc or with your internist really starts to pay dividends later on. That's the part of controlling blood pressure, of finding out about your cholesterol, knowing your numbers. That's the other kind of important tagline here. And looking for things like diabetes. And if those are present, making the changes that are necessary through lifestyle adjustments, through exercise, as we've heard about, and sometimes through medications to lower that risk, knowing that what we do in midlife is going to lead to a healthier brain in later life. And then as we even move out of that stage, well, that's part of screening for things like vision loss and hearing changes. And we need to be more active about that. We need to take an active role in it. We need to know our numbers. And that's all a part of the program that we're trying to really establish and promote so that we can change that risk profile. We want to change it for everyone, but we especially want to change this disparity, this twice the risk, and do things that we can to reduce that effectively.
Thank you. Ms. Francine, how can caregivers best support the cognitive and emotional needs of individuals with dementia memory decline?
So probably the very first thing a caregiver can do to support their loved one is to take care of themselves. And I know it's like an old adage, but it's similar to when you get on the airplane and they say if you're traveling with a child or someone that needs help and you need the oxygen mask, put it on yourself first. Because if you're a caregiver and you don't care for yourself, you're not going to be able to help anyone. And if you are close to the person with memory loss, so you're the spouse, or like Tan mentioned, she's a daughter, you probably know the person best and are one of the best people to be able to support them. So one, you have to take care of yourself. Two, if you don't have patience, I will tell you, you've got to figure out how to get a little bit patient. So when a person has memory loss, they are going to be repetitive. They are going to forget new information. And they might struggle with multiple tasks in one sentence. So for example, my husband had brain injuries, and I learned quick that if I said, could you go in the kitchen and get me a glass of water, he would go in the kitchen, and that would be the end of it. So sometimes you just have to learn how to rethink your process, and that also goes hand in hand with realistic expectations. When a person has short-term memory loss, that means they're going to struggle with what happened yesterday, what they were exposed to do today. So coming up with some strategies that work, whether it's written reminders, only discussing what's the next thing on the agenda for the day, not trying to do the whole day. And a couple of other things are, you do have to just be really supportive. You have to learn to laugh a little bit. You have to learn that the person's long-term memory is quite sharp. And often, if you rely a bit more on that, it'll make it a little bit easier. It'll cause you as the caregiver to be less frustrated with day-to-day life. And then again, it's all about maintaining a quality of life. So if you're trying to care for a relative and you're also working full-time and you're also, taking care of the house and the bills, think about what you can delegate. I always used to say, anybody can clean a bathroom. It may not be exactly the way you like it, but it's clean. So think about ways of delegating some of the responsibilities.
Thank you, Ms. Francine. Also, what are some resources that are available to help caretakers?
So there are many types of resources, anything from support groups that are online or in person, resources that can come into your home, resources that you can gain online. Basically, there's anything from one end of the spectrum to another. And I do think we have copies of a resource list that I've created over time to share with you. But there is help. And it's kind of can be a little overwhelming to decide what you need. So sometimes it's good to keep a little bit of a personal journal for just even a few days, and then go back and see, what did you struggle the most with? And often people say it's the paperwork, like filing medical insurance and paying bills. So I'm a strong believer in that there's a job for everyone. So if there are other family members, and think about what you could ask another family member or a neighbor or a friend to help you with. But we'll have, later today I'll be talking about individual resources as well. Thanks.
Thank you so much. And I don't appreciate my sister talking to you about the cleaning the bathroom thing. Because in a very transparent moment, I really struggle with, it doesn't have to be done the way I would do it. Like we're just trying to have a good day. So thank you for stepping on my toes there. Ms. Pam, what are some common misconceptions about brain health and memory decline that need to be addressed, and why?
Wow, there are a number. But let me just hit on a couple. One of the first ones is I've heard a number of people say, well, oh, that's just old timers disease. And the implication being when you get old, that's a natural part of aging. Not. That is not a natural part of aging. So I think that's the first misconception. The second, and this is probably endemic to families such as mine, people of color, oftentimes there's a stigma talking about memory loss or anything that approaches the memory. We're fine saying, well, my ankle hurts, I really need, what do you think, who should I go see about it? We're fine saying, my diabetes is, kind of out of control, I need to go back to the doctor. But to say, I don't know that I'm remembering things like I used to. We are not fine talking about that. And in many instances, it's almost a taboo subject, such as when I shared a few minutes earlier, when we mentioned it to my dad, while we were all in denial, he wouldn't even talk to me for a couple of months. So I think those are things that are endemic to our culture and that we need to challenge ourselves to overcome those things. Another thing is, and I've lived around the country due to job transfers, but especially here in the South, in the Southeast, there is still, and for good reason, some mistrust, lack of trust of the medical profession. And let's face it, it has an ugly history. And we can't deny what happened. We know about probably the most famous situation, which was Tuskegee, but there are many other situations that may have gotten the notoriety that Tuskegee did, but they happened. And those things get passed down by word of mouth. So sometimes we're not trusting that if we go and seek medical advice, that they'll have our best interest at heart. And so to that I say, something that I don't believe we're taught is you need to learn to be your own health advocate. Just as if you were going to get your car repaired, you notice that the engine wasn't running right, you're going to go to the person you trust who has a track record of making that repair in a way that you're satisfied with. And so often, and I know in my family, you went to Dr. Schmedlack forever, and you never thought about going to someone else. Well, you need to get a second opinion on many things, and especially when it comes to anything dealing with this thing up here called the brain. The brain controls everything below. It's really important that we get the right resource and that we have trust in that resource. And if we don't, there is nothing wrong. Get a second, third opinion. Case in point, I had a cousin who lived in Daytona, and his wife was beginning to show signs of dementia. And he said to me one day, I'm taking her to the neurologist. We've been going and going, but nothing's happening. I'm not sure what he wanted to have happen, but he wasn't getting any satisfaction, I guess, of understanding. So I said, okay, ding, 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 Francine, can you get him into the ADRC at Mayo and let him come on up and get evaluated and have his wife evaluated? His report back to me was that one day spent with the multi-stages of evaluation, which they'll cover later, was more impactful, and they learned more from that than all the visits they had been going to the neurologist in Daytona. So just like if someone says to you, I think we need to do surgery on your knee, get a second opinion. And another thing I would suggest is if it's about you, take someone with you who you trust, who can help navigate the conversation. Because we don't often plan. I think of it as a business meeting. This is someone I'm paying, and I want to make sure that for the 15 minutes that's allotted that I'm paying X number of dollars for, I get my questions asked and answered to my satisfaction. So prepare for that like you would a business meeting. Go in with, these are the questions I want answered, and if the answers come out in language you don't understand, say, hold up, break it down in non-medical language, because I need to understand it. I need to understand what it is, what the consequences are of doing versus not doing, so that I can make an informed decision. So for example, for myself, I had a medical condition a few months ago that thankfully I've overcome, but I knew I was going into that appointment to talk about me, and it was a little bit touchy. So I asked a dear friend to go with me. I said to A, make sure I'm asking the right questions, and then we can debrief each other afterwards so that when I leave there, we both come out of there with the same understanding. Or if I miss a question, you jump in and ask the question for me so that I have the information to make an informed decision about not only the diagnosis, but the courses of actions and what courses of actions I want to take. So it's a lot of words to say, learn to be your own health advocate. And then lastly, because I could talk about this forever, we don't realize how rampant memory loss is in the African American community. And I'm not going to ask you to count off 1, 2, 3, 4, 5 and start again. But what I will tell you is the data shows that 1 in 5 people, you hear me, 1 in 5 is going to develop some form of memory loss. That's pretty staggering. So we need to do all that we can, listen to these folks here who are trained to try to prevent it, or if it starts to creep up, to get it appropriately evaluated so you can have the best quality of life and the best quality of care. So learn to recognize the symptoms of memory loss. And as I said, for myself, I was in denial for a number of years with my mother. Get a comprehensive diagnosis. You don't just, and I'm not going to shadow up what they're about to say, go to your family physician, and I don't mean to belittle any family physician, and get one person's opinion of whether what you're exhibiting is normal or not. There's a process to get appropriately diagnosed. And as you heard in that video, and as I mentioned earlier in my comments, get involved in discovery programs. When pharmaceuticals go to market, historically over the years, they used to go through clinical trials. I worked for Johnson & Johnson for years, and the clinical trials were often done on white men in the Middle West. And then if they met the criteria for being safe and effective, they were then deployed across the nation. Well, what's to say that a pharmaceutical that works well on a white male is going to work well on a black female, unless us black females, black males, get involved in various discovery programs. And if you get involved in discovery programs, sometimes while in the discovery process, you can get a jump start on that treatment that may not have actually gone through and been made available to all the public. So, do your homework. Don't let anybody dissuade you. Don't let anybody tell you this is normal. As you wouldn't walk around with a hurt arm and not get it appropriately evaluated. Take care of this.
Thank you.
Parents had been on vacation with us up in Martha's Vineyard. And prior to that, my husband had kept saying to me, your mom seems like she's getting more than forgetful. And I didn't want to hear it. The aha moment for me where I realized something was wrong was when she stood at the sliding glass door and did not know what to do. So when I returned after vacation and I mentioned it to this young physician who was a radiologist at Mayo, he said, she may be having Alzheimer's. And I said, what is that? I had never, to my knowledge, heard the word before.
I started noticing with my mom when she started repeating herself
she started accusing me of taking things that she had misplaced. So in doing that, I just started watching where she started placing things and helping her remember where she put it.
It is something that you are just never prepared for, and all of a sudden you find yourself into this process, and now you're trying to navigate through the process. My mother was the first person that I became aware of with the diagnosis of Alzheimer's. My mother would go to her primary care physician and she'd talk about her concerns, or she would, in talking with her deacon at her church, would share her concerns as to why are these things happening to me. These things that she's referring to, we later learned were hallucinations, hearing sounds. All of a sudden, my mother has always been the family member who paid all of the bills. She was having difficulty paying her bills, writing out the check amount, and becoming easily frustrated.
And so I remember my mom, when I was growing up, having to wake up in the middle of the night because my grandfather would call about my grandmother. And so it started to, the Alzheimer's disease and dementia issues started to impact my family early on. Well, the first thing I think my mom did was to bring someone into my grandparents' home to help take care of her on a daily basis. My mom, late in life, suffered with dementia and Alzheimer's. And so I also made sure that there was someone at my parents' home to help take care of my mom and help my dad, because it's also a very emotional issue for families to see your loved one not being able to remember things, or when you take the keys, they are very upset because they're in between that independence and dependency. And so it's very emotional.
My parents.
My next question is for Dr. Day. What exactly is dementia, and are there different forms of it? And why is it important for us to know what specific type of dementia we have?
So this is a very common question and an excellent question, and we all need to know the answer to this one. So
excuse me, Dr. Day, they asked me to ask you if you could hold your mic a little closer.
oh yeah, I can definitely do that.
That's
I
it.
can
Give us
always
the Barry White, Dr. Day.
I can always be louder. When we talk about dementia, the word really is just a description of symptoms that our patients and their caregivers share with us. So it quite literally means a change in memory or thinking, so something that's different from before, causing problems to the point that you can't do all the things that you used to be able to do. And so a change in memory and thinking that disrupts daily activity and represents a difference from the prior baseline. And so if you're going into your doctor with a concern about memory, or maybe a concern about a loved one's memory, and they say, and you tell them that there's a change in memory and thinking, and here's a list of things they can't do, and they turn back to you and say, oh, this sounds like dementia, you want to know that you haven't really gotten any new information. You just got a nice word to describe the symptoms that you reported. You should be about as satisfied with that as you would be if you went in to see Dr. White and you said, my nose is running, I've got a cough and a sore throat, and he said, I think you have a cold. People don't tend to accept that. They really are there because they want the next step. They want to know, what is the cold due to? Or if there is dementia, early symptoms of dementia, what is it due to? And so when we talk about colds, we'll think about allergies, bacteria, and viruses, and the answer to that question directs the next steps in treatment and the prognosis. So it's going to help select medications and tell you what's coming next. How long is it going to be till I get better? With dementia, the number one cause is Alzheimer's disease. And so people ask me all the time, what's the difference between Alzheimer's and dementia? Well, they're actually one and the same. Alzheimer's disease is the change in the brain that leads to dementia. Outside of Alzheimer's disease, there's many other causes as well, all less common, but you've heard about some of them already this morning. So vascular disease, heart disease that affects the vessels in the heart, affects the vessels in the neck and the vessels in the brain, and those changes can also lead to dementia over time. A disease called Lewy body disease, which is a little bit less common, but due to buildup of other proteins in the brain is another common one. And then we sometimes think about a category of diseases called frontal temporal lobar degeneration. So those are the big terms that we think about, but by and large, it's Alzheimer's disease as the #1 cause. And as I've said, the answer to that question, knowing what's the cause of symptoms, is going to help select treatments, research opportunities, and answer questions about prognosis and what comes next. And while I haven't come out and said it flatly, sometimes there's a very different cause of dementia. And so that could be a brain tumor. That's pretty rare, but obviously if we recognize that, the treatment for that is very different. It could be a vitamin deficiency, or a thyroid disorder, or other systemic disorder, something else in the body that's affecting the brain as a consequence. And so getting the right answer is the first step toward getting the right treatment.
Thank you. That getting the right answer is the first step to getting the right treatment. I think if that was one billboard for this event, that would definitely be it. Thank you so much. Dr. White, how do I know if my forgetfulness is normal or if it's something that I should get further evaluated?
Yeah, so Dr. Day gave a fantastic answer and description of what dementia is. So that's another common question that we sometimes hear. How do I know if what I may be dealing with is sort of on that normal spectrum, or if it's moving into that area where we would start to be concerned as a medical professional about that individual developing what we would consider to be early stage of dementia or a mild cognitive impairment versus, the more severe form of dementia. So, when Dr. Willis, myself, and Dr. Day went to medical school, one of the first things that they did before we started learning about diseases and things that would go wrong is to really understand how we were made, how the body was designed to function. We truly are fearfully and wonderfully made. I know you all have heard of that. So you think about recognizing when something might be going wrong. I think it's important to keep in mind and understand what our brains were designed to do. And Dr. Day talked already about, one of the really important functions of our brain is our memory. But the brain does a whole lot of other things in addition to that as well. Our language, controlling our movements, our emotions, how we interact with the world around us. We refer to that as our visuospatial abilities, our executive function, or how good we are at making decisions. Those are all things that the brain is responsible for managing for us. And so when we think about how we know if something is starting to go wrong, well, all of us, I think, have experienced where we've walked into the kitchen and you've completely forgotten why you came in there. Or you may, after service, avoid that individual in the fellowship hall because for the life of you, you just cannot recall their name. So it's better just to make a beeline to the car and go look it up in the church directory and try to make sure you know it for next week. There's certain things that as we get older, there's some normal decline in our cognition, in our functioning. But I think as Dr. Day pointed out, really important, those types of declines don't typically cause any impairment in our ability to do what we need to do throughout the day. And so we can start to recognize when things maybe are going beyond normal cognitive decline and maybe into that category of a mild cognitive impairment. That impairment is important because it's starting to impact on somebody's lifestyle and somebody's ability to interact with a loved one. Or, the forgetfulness is maybe starting to become a little bit more out of proportion than what we would typically see for that person's age and for their education level. I think that when we start to see that repeated levels of forgetfulness or doing things that are definitely out of character, we've heard in some of the videos that people have explained some of their loved ones starting to do things that, that's really, mom's never done something like that before. Or mom's never repeatedly forgotten, that family member's name, or forgotten how to do that type of task. When we start to see things that start to create impairment or that are out of proportion with what we know is typical, the baseline, what's usual for that family member, then I think that those can be some clues that there might be something else that's going on. I love some of the comments that Francine made about, and that Ms. Pam made about, really being an advocate and really, getting your questions answered, being comfortable with talking about these things in your family. I think understanding our family history as much as we can, I think, is really important too. To know if you've got a lot of multiple family members over multiple generations that have developed diagnosis of Alzheimer's, and that could be a clue that there might be more of a risk, higher risk for an actual degenerative process. As Dr. Day said, some of forms of dementia are irreversible, like the Alzheimer's, Lewy bodies, but there are other forms that might contribute to memory loss, which could very well be reversible and treatable. So in addition to understanding our family history, I think it's important to advocate for yourself. As a primary care doctor, you come to see me or Dr. Willis, you may get 15, 20 minutes, in your visit, and there's lots of things that may need to be covered, but if memory concern is at the top of that list, make sure that you don't leave that office before you've had a chance to get that question answered, or that there's been an action taken on your behalf or on your loved one's behalf to address that issue. So I think just being vigilant, understanding what normal is for your family member and for yourself, and when things start to happen that are outside of that, it could be a clue that there may be some early cognitive impairment or risk for dementia.
So if someone feels like that their forgetfulness is not your typical aging, how is that evaluated?
It's a great question. So in my office, again, is where a lot of times these initial evaluations start and conversations start to happen. And if I identify or if I have a significant concern that the individual in front of me is displaying some clinical signs and some symptoms that might be concerning for mild cognitive impairment or for dementia, there's some things that I can do in the office that are short, don't require a lot of time, some short memory type testing. Mini mental status exam is something that can be done. There's even some shorter assessments that can take place. There's something called a mini-cog, which can be done in a primary care setting. So there are some tests that you can ask your primary care doctor to do to see if they might be able to document. These are really screening tools, screening instruments. And if there's some abnormalities that are identified there, your provider can ask your loved one or yourself to name objects, to try to do some short recall. And if there's some abnormalities in there, what I typically do in my practice, and I know Dr. Willis is the same, is that we'll send somebody on for more formal cognitive testing. And that's where we're doing a warm handoff, a pass on to our very capable expert colleagues like Dr. Day and others, who are able to do more specific neurocognitive or neuropsychiatric testing. And that's a much more in-depth, detailed battery of testing that can really kind of get into some of the nuances about somebody's memory and really identify whether somebody might meet a diagnostic criteria for dementia or might meet a threshold for having a mild cognitive impairment. And like Dr. Zay said, which is critical, you don't know how to treat it unless you actually know what is there. And so that's really kind of what's involved with the evaluation process.
And if someone is diagnosed as having memory loss, is that reversible?
So again, it depends on what the underlying cause is. If somebody is having a process that seems to be progressive and seems to be declining over time, that could be indicative of there being an underlying dementia, which some of those unfortunately are not reversible based upon our current knowledge. But we'll talk more about, there's research, why we've alluded to already today, the importance of participating in research, because there's a lot of research that's going on to try to better understand what we can do to treat, to prevent, and I think even potentially try to reverse. Who knows what the future of medicine shows, but it's really important for us to participate, to increase representation of people that look like us in those studies, so that we can better understand how we can treat dementia.
Thank you so much, Dr. White. If you asked a question, so of course that means you don't have an index card anymore, but you have another question that you want to submit, you can just put your hand up and they'll come and give you another card, and then you can submit a second, third, fourth, whatever. We want you to get all your questions out. So don't think once you've asked that one question and that's it. Just put your hand up and someone will bring you another card.
So in the African American community, you often hear people talking about, oh, she just got Alzheimer's, or this is normal aging. I think this is a very sensitive thing to discuss, particularly in the African American community, because of that sense of respect for elders and a sense of dignity. And so I think with us really being open about it and transparent about our own experiences with loved ones who have dementia, particularly Alzheimer's disease, then we can let other people know that this is a normal process. People are getting older, they're living longer, and that's really the greatest risk factor for developing dementia. And so in time, so many of us are going to be impacted by dementia. We just want to make sure that people get the right resources that they need at the right time. So when a family member or a person with dementia comes to seek evaluation for dementia, I think there are a couple of things that they should be asking the physician. You know, you first want to know, is this a reversible cause of dementia? Because before we diagnose somebody with an irreversible cause such as Alzheimer's disease, we want to make sure that we're not missing something that potentially could be reversible. So I think that's the first question. I would say the second question is, if in fact it is dementia, what are the types of studies that need to be done to help suggest or support that diagnosis? The third thing would be, what are the treatments? What are the interventions? What can we expect also along the course of this disease? And the last thing I would say, you want to know about the resources that are available, both for the person with memory concerns, but also for the loved ones.
Dr. Day, what are some of the most promising areas of research in dealing with dementia and brain health right now?
So when we think about the future for research, I think we're looking at two different pathways here. One is, can we prevent dementia? We're really at that stage where that's the question that we're most interested in answering right now, because I think that's the question that's on many people's minds sitting here. And we can break that down into two potential strategies that are being explored through research at this present time. And one is through making those lifestyle adjustments and lifestyle changes early on, maybe in the 40s, 50s, 60s, even a little bit later. And so we have studies that are open called observational studies. These aren't studies that come with medications, they're studies that come with information. If you're worried about your memory or you're just interested in your memory, you can come in, be assessed from a neurologist and from the rest of the team, do some tests of memory and thinking, and then have a really comprehensive examination that includes blood tests measuring things like cholesterol, diabetes, thyroid, vitamin levels, other things that we think might influence risk in the future. And so this is the idea of knowledge being power. The more that we know about our health right now, the more we're able to do to change our future. And we give that information back to people with that idea of knowing your numbers is important, and we encourage our participants to take that information and talk with their doctors, to make decisions together about their health, maybe make some positive changes. And so preventing dementia through correcting, recognizing, and changing lifestyle factors is a big line of research right now, and one that I think is really important. The other line of research is this idea that maybe in those people that are at highest risk to develop dementia, so people who already have changes starting in the brain of a disease like Alzheimer's disease, maybe we can do something then to stop those changes and prevent symptoms of memory loss from ever coming on. And so one of the biggest avenues for that right now is a national or nationwide clinical trial where healthy people who are over 55 or getting older, even beyond that, come in and have a screening, they have an assessment, and then agree to undergo a blood test to measure proteins that can tell us about the risk of Alzheimer's disease. If those proteins are present, there's further testing that happens to see, is Alzheimer's changes present in the brain? And if they are, those patients or participants can be involved in a clinical trial where they receive medications to try to remove those proteins from the brain, where they receive really close follow-up, with the whole goal of that study being finding at-risk people, eliminating the proteins or the changes in the brain, and preventing the onset of memory changes in the future. So two really exciting pathways, very different approaches: observation, information, numbers, and testing, and if at risk, potentially the option to receive an investigational drug to eliminate proteins in the brain related to Alzheimer's disease.
Thank you so much. If I read this question the way it was written, it would be humorous, because it says, I heard that caregiving can be stressful. I heard, no, I live. Caregiving is very stressful. But Miss Faith, I'm asking, the question is that we know caregiving is very stressful. Um, and let me just add, we're talking about brain health today, but caregiving in general, no matter what the situation is stressful. So the information that she's going to give now, this is for anyone that is a caregiver. What are some things that you can recommend for caregivers, some tips to help this life be less stressful for those of us that are living this?
Yes, caregiving can be very stressful. And I mentioned a couple of things earlier. A caregiver has to be able to find a way to take care of themselves. It's very interesting that over 50% of female caregivers over the age of 50 will experience depression and an increase in high blood pressure as caregivers. And that's, many years that a person could be in the caregiving role. So a couple of things are to really consider a daily schedule for yourself that includes some of the things Dr. Day and Dr. White have mentioned. Like, how am I getting my 30-minute walk in? Does that mean I have to get up a little earlier and go for a walk while the person I'm caring for is still sleeping? I've told many caregivers, okay, your regular wake time is 6, try 5:30. It sounds ridiculous, but that 30 minutes of maybe peace, quiet, a little meditation, a little stretching, having a cup of coffee or a cup of tea just by yourself can sustain you much longer through the day than if you're popping up at the same time as the person you're caring for and immediately are feeling stressed by answering the same questions or having to tend to their needs. Keep up a social network and a social calendar. You just have to. You cannot, turn away from your own support networks. It's like, who supports you? If you're supporting a loved one, who is going to support you? It's possible, especially if it's a spouse, that they are not supporting you in the way they used to through the years. One of the things that is quite common in a married couple is the person with dementia loses some of their insight, so they may not pick up on cues that you're tired or you don't feel well. And sometimes they become a bit more self-serving. Their needs sometimes come before yours. So you have to figure out a way of keeping your social network, your exercise, and keeping your health. And if that means having someone to come in to stay with your loved one once or twice a week, that is your energy booster. So I think the main things are keeping your health, getting enough rest, exercising, eating well, and not allowing yourself to be isolated.
Thank you so much. And if I can add to that, again, 18 years of living this day by day, what I find in sharing with people, because I make my life very public on social media with my mother in efforts to help someone else. And we do find a lot of humor in those long-term memories. But what I find is people feel guilty for taking that time to themselves and not understanding that if you don't do those things that you just mentioned, then you will not be able to deal with the days that they may be a little more difficult, the days that they aren't so nice if you don't keep up some form of a social life, find those 30 minutes to just walk, take time to yourself. So I encourage anyone that is watching online or that is here in person, you have to take care of you. You cannot be there for them if you don't take care of you. And sometimes it may feel a little selfish. It may feel like you should be focused on maybe you wash your loved one's clothes. Maybe you can let someone else wash them. They have services that will wash, fold. That's not something that we would normally do. But if it gives you 30 minutes to have some time to yourself, then I advise you to do that. Thank you, Ms. Francine. Dr. White, we've heard a lot here today about high blood pressure, cholesterol, diabetes. How does high blood pressure, high cholesterol, and diabetes impact dementia?
Yeah, that's a good and it's a specific question. So basically, the three work together in you think about what keeps the brain healthy. So adequate nutrients that is supplied by the blood, adequate oxygen from the blood. The brain is one of the highest users of oxygen. When other organs are in danger, our bodies were designed to really protect the brain. So sometimes at the expense of other organs. So the way that diabetes, particularly hypertension, high cholesterol work, cholesterol, if it's too high, you're at risk for building up what we call cholesterol plaques. You're probably more familiar with that in the setting of like a heart attack. If somebody has really high cholesterol and they build up a lot of cholesterol on the walls of the heart, or the walls of the arteries, those plaques can rupture and basically can cause clots to form. So similar type of process can happen in the vessels that supply blood and nutrients to the brain. You think about like a stroke. So if someone has a stroke, it can cause sort of an abrupt change in somebody's neurologic function. But slowly over time, a lot of times when we image people's brains that have more of the vascular type of dementia, or we can see areas where there's microvascular disease. So in the smaller arteries, the smaller blood vessels in the brain can show evidence of disease. And over long periods of time, that can be a contributor to dementia. Diabetes, basically, if you're living in a state where your blood sugar is too high, high glucose levels, high blood sugar levels can be toxic to neurons. Dr. Day and other neurologists are very adept at treating patients that have complications of diabetes that cause damage to the small nerve fibers. Neuropathy is something that is a complication from diabetes. So we weren't designed to live in a high glucose state within our bodies. Glucose, too high levels of glucose can be toxic to small vessels and to small neurons within our bodies. High blood pressure, if that's not controlled well, if you're constantly think about your heart and your blood trying to pump against a high pressure system, you think about then there's backup in the plumbing and things back up. If the arteries in high blood pressure harden over time, and that's one of the reasons why a lot of the blood pressure medicines that we give cause the blood vessels to relax and to lower the blood pressure. But if there's too high a pressure inside the vascular system, then that's not healthy. It could increase risk for stroke, increase risk for heart disease because the heart is having to work too hard. So a lot of those things kind of can work in tandem. And unfortunately, a lot of patients that Dr. Willis and I see have all three together. Have diabetes, have high blood pressure, have a history of stroke. So someone that comes in that situation that has really high cardiovascular risk, is going to also have a higher risk for developing particularly vascular types of contributions to dementia.
So should our young people be concerned about their high blood pressure, cholesterol, diabetes?
Absolutely.
Even though they're healthy now.
Yeah, that's one of the biggest challenges. And as a pediatrician, as an internist, I have the privilege of taking care of pretty much individuals across the lifespan. And I do see, young children, preschool age kids that are carrying too much weight for their height. And it's something that we try our best to address with families. As Dr. Day was saying, really the dementia that we see in the 7th, 8th decade of life, really the beginnings of that really can occur within childhood. The types of environments that children are exposed to can at least start to build a negative foundation that if over a lifespan is negatively built upon with increased risk for these types of conditions, then unfortunately we may see manifestation of that disease later in life. I talk with my college kids, I talk with the high school students that I take care of about the importance of eating healthy, about being active, not necessarily having to play a sport, but just getting outside and being active, decreasing their screen time, managing their weight. All of these things are really important. It's never too early to help families and individuals understand what they can do to maintain a healthy lifestyle.
Thank you. Dr. Day, how do our viewers and our audience members, how do they discover, learn about the treatments that are taking place at Mayo, and what can they do to help with these treatments?
Yeah, I appreciate that question. We want people to know what's going on in and around their local area, so at Mayo and beyond. I think obviously if you're worried and concerned about memory, or if you've received a diagnosis from your doctor and you're looking for medical advice, so that's the treatments that are approved by the Food and Drug Administration that can be written with a prescription, well, I think the most direct path is to seek a referral to a specialist that's treating memory disorders. And that can really, we can take the time to go through what are the current conditions, what are medicines that you're already taking, what are the options for what you might want to consider, and select those together. And so that's a discussion that usually happens in the context of a typical clinic visit. You've heard about clinic visits. I think we all know our clinic visits with our primary care practitioners, 15, 20 minutes, and trying to get a bunch of issues done. When we're talking about memory and really assessing the whole picture, it's a 45 to 60-minute visit. And so it's a really in-depth assessment, and that's accessible to people that live here in the city, and lots of other partners throughout the state and other states as well. When the question, though, is about other research opportunities, so that can happen if you're talking with your specialist as well. They should be able to tell you about what's going on at Mayo Clinic and other centers. But if you're in the comfort of your home and you want to know, you can check out the clinic's website looking for research opportunities, in particular our Memory Diagnostic or Memory Disorders Center and our Alzheimer Disease Research Center, where we post a lot of updates about the studies that are open to participants. Coming to events like this, of course, we appreciate getting to see everyone in person, and everyone coming in through everyone watching from home is another opportunity to learn about what we're doing now, but also what we will be doing in the next few years. And I think that's the perspective that we're sharing right now. And finally, if you like websites that look like they were built in the 1990s by the federal government, clinicaltrials.gov is the one that I use, and it's the one that I think most of our partners use. Every single clinical trial, so medication-based study that happens in the United States, needs to be posted on that website. And by typing in a few criteria, where you live, what you're interested in, you can find out really about all the studies that are open and enrolling right now. And that includes contact information if you're looking to follow up on that. Now, I usually tell my patients that if you see something on there that you're interested in, let's start a conversation about it so that I can give you the inside scoop. But you've got a lot of information really just at the fingertips, and a lot of good sources for that. And our community partners provide additional excellent sources as well. The Alzheimer's Association is a very active group, advocacy group, but also has some infrastructure to connect individuals to potential research opportunities. And so having a conversation with them is another pathway that we can go.
Thank you. Well, now we're going to open it up for our questions and answers. And I'm going to actually start with, because it will tie into what you just said, I've gotten several cards that are asking how can they get involved in the studies at Mayo, and is there a cost?
I'll certainly answer that. I think today, if you're here in person or online, just reaching out and connecting with us either by email if you're online or at any of the booths outside, providing your information is step number one. That allows an opportunity both for you to tell us what you're interested in, and for us from the research side to tell you what's available. And so that's a great way to connect. Outside of today, really picking up the phone and giving us a call at the Mayo Clinic, looking at the Alzheimer Disease Research Center, you're going to reach one of our amazing team members who We'll get back to you, and again, we'll tell you about all the studies that are going on, trying again to match your interests, the information that you want, to what we can provide right now. And we've got amazing community ambassadors that really know our programs inside and out. And we've got a couple, well, one right up here. You can always talk to your community ambassadors. Some of them attend in this congregation, and all of them are really involved in the community, promoting this central mission. So reaching out to those that are around you is another strategy.
And with these questions, whoever feels led to
and
answer.
I got to interrupt because sometimes I forget, and I forgot to answer the part about cost. And that's so there's a cost to research, but thankfully in this country that cost is something that we all pay for together, most often through our tax dollars. And so we're very fortunate that by and large, the vast majority of the big research programs that we're talking about are very well funded through grants from the federal government, also from the state government, and even from our local government and our other partners, some of whom you've heard me talk about. And so what that means practically is that we've already paid for this research. I mean, each of us in our taxes and in all the other things that we do. There is and should be no cost to research participation. And the programs that I'm talking about, none of them come with a price tag. None of them come with bills or requirement for insurance. You shouldn't be seeing anything show up at home several weeks after, as can happen when you're seeking clinical evaluations. And so that's a really important thing to say. We do recognize that coming to the clinic, and a lot of studies do require people to come and see us at the clinic. That has a cost in terms of transportation, time. Your time is valuable, your partner's time is valuable. And so we do what we can to offset that cost. If transportation is a limitation, maybe you just don't want to drive across that meandering pathways of overpasses that can be confusing at the best of times, especially during high traffic volumes. We're going to fix that. We're going to provide opportunities for transport in a car that can bring you to and from the clinic. If there's costs in taking time off of work, we try to supplement that for people, especially people who are involved in many of these programs that require you to come back, by really it's small amounts of money that compensate for some of the time and investment in the research. And so we don't send bills. We do try to make sure we offset the costs, the natural costs that are experienced by taking time out to be a part of the research study.
Just to add something really quick to what Dr. Day was saying. We know, as Dr. Day mentioned, that Mayo Clinic oftentimes is not a convenient location for the community because of where it's located in proximity, or in non-proximity, I guess the opposite. One of the things that Dr. Willis, myself, and others, Dr. Lucas, we're really, Victor, we're really working on ways that we as an institution can improve our ability to really engage with the community. Not just invite the community to be involved with research, but how can we involve from the beginning the community at really every stage of the research process? That's something that's really critical. It's something that's becoming more and more and more of a priority at Mayo Clinic, of how we can partner with the community in our research, not just research. So it's looking at research with the community, not just research on the community. And I would just, a plug for research and just in general is one of the advantages if you decide, research is always voluntary. Because of the past sins that have happened in our nation with regards to medical research, there are certain rules and regulations that are really strict and are in place that have to ensure that an individual is informed about the research decisions that they're making, that it's on a voluntary basis, that research results are getting back to the community and are being shared with a broad population. One of the advantages that if you decide to participate in research, as Dr. Day alluded to, is that you sometimes have access to really high cutting edge types of imaging study, particularly in the context of dementia, that would otherwise potentially be costly if gone through insurance or be associated with other out-of-pocket costs. Having had the vantage point as someone who's not in the neurology department but has partnered with my neurology colleagues in a lot of research, seeing some of the studies that are designed and the types of imaging study that are available for people that participate in their research studies, I think that it could open some doors for some imaging and opportunities that might otherwise not be available as easily through regular routes of care.
Thank you. I've gotten a couple of questions from our audience wanting to know about different types of vitamins that may be available for a healthy, for brain health, and if they should consult with their primary care physician before taking any of those things. We all see all of the infomercials and different ads for supplements. So is there something that you can say helps? And should they talk with their primary care physician before taking those things?
I'll start with that. I think if you're watching TV at 3 in the afternoon or 3 in the morning, you're going to see a lot of these ads. And there turns out there's a lot of vitamins and supplements that your doctor doesn't want you to know about. The reality is there's not a lot of data that supports the vast majority of those vitamins and supplements, and it is a big business industry. And so we want to be cautious about what we're recommending. The recommendations that we can make that rest in evidence and medical data suggest that for most people who have a healthy, balanced diet, who don't have medical problems that would prevent you from absorbing a specific vitamin, a simple multivitamin once a day is probably the right recommendation. Now, if your doctor has told you that you have a problem in one of these areas or a low level somewhere else, you might be on additional supplements, but the evidence hasn't really panned out for any of these specific supplements to boost memory or prevent memory changes. Now, I think we're also open to the reality, though, that there's not enough studies for every question that comes up, and every agent hasn't been evaluated. And so what I usually tell my patients, we can look at what's in it. We can make sure it's not something that's likely to harm or to interact with other medications, and so that emphasizes the importance of a discussion with your medical practitioner. And if there's nothing in there that's likely to cause harm, well, maybe there's something in there that could benefit you. And so a trial is generally okay. And that's assuming that it's not going to come with very high costs. If you're taking something, whether it's a vitamin, a supplement, or a medication, and it's not doing its job, it's not giving the intended intent, well, we probably shouldn't be continuing to take that. And so a trial of that vitamin or supplement can be appropriate, and then it'll help position you to make a better decision about whether it's something you think is worth continuing. I don't know if you had anything to add from your side.
No, Dr. Day, I think that was a fantastic response. The only thing that I would add is that a lot of the vitamins and herbal supplements that are available either over the counter or at the high-end vitamin stores, your healthcare provider and team needs to know about those as well. So I think I would just add that it's important to understand that those are included among the list of medications that you're taking. Sometimes when I ask a patient to bring in all of their medicines, I can see on my screen the ones that have been prescribed, but oftentimes they pull out 2 or 3 bags of additional vitamins, oftentimes that are very overlapping. Our body was designed, for certain vitamins that are more than what the body actually needs. I tell my patients sometimes, you're just actually peeing orange juice because of all of the vitamins C that you're taking or an extra potassium. Your body's just processing it and just eliminating it. So I think Dr. Day made a good point. Sometimes people, because of what you hear in the news, whether misinformation or just an overwhelming amount of information, sometimes people, it's creating an unnecessary financial burden on them because of the multiplicity of vitamins and extra supplements and herbals that are being taken, whereas there may be an opportunity to de-escalate that burden, actually save some money to go towards some other important areas of your life, particularly if there's not good evidence base saying that it's really helping to slow down or improve or boost memory. The other thing I would add, just from a primary care perspective, is that when we're on a lot of medications, if you're taking some herbals, it's important to have that discussion with your provider because there potentially can be some interaction with some of those herbals, ginkgo biloba, some ashwagandha or whatever, how do you ever say that? But a lot of these things, there sometimes can be some interaction with some of the prescription medications that you're taking. So this is just important to be transparent and open. Again, like Dr. Day said, with my patients, if they're on a herbal supplement and it's not causing harm, then I usually don't have a problem. I said, if you want to continue to take it, if you feel that it's helping boost your energy, then I don't have a problem with that.
Another question. Is there a connection between PTSD and brain health and also brain injury and brain health?
I'm probably the best person to answer that, but that is one of those areas where we lack a lot of data to show that connection. I think there is emerging evidence, though, that really does suggest that the things that happen to us earlier in life, the stresses, the traumas, the things that we carry with us, and I mean both psychological and physical, so the traumatic brain injury parts definitely have an impact on how we function later in life. We know that depression, so having symptoms of depression or untreated depression, is a risk for dementia later on, and PTSD is a risk for depression, and so we don't really have to go back too many steps to suggest that those things are going to be connected. And so that emphasizes the importance of treatment at each step of the way, at facing these issues and working with loved ones, with community members, with the resources that are available through your church and through other places as well, to try to work through some of those problems, and having that discussion with your doctor when appropriate, because sometimes medications can help with that also. Traumatic brain injury has been connected to an increased risk of dementia. Certain types of dementia, probably a bit more likely. I think the general rule here is that we injure the brain that we have. And so if you're starting from a place where you already had some brain injuries and now you have another problem developing, maybe changes in the blood vessels, the vascular disease, maybe Alzheimer's, it's going to probably get worse earlier and maybe progress faster if you've had previous brain injuries. And so, yeah, wear a helmet on your bike is advice we can give in that first and second decade, and keep doing things that protect your brain as you move forward. Are all very practical words to live by.
Thank you. I will say 18 years ago, a lot has changed, but that is one of the explanations that we were given for my mother's diagnosis at 58. She was in a car accident some years before and hit her head, had some trauma from that, and that is the explanation that the doctors gave us. But again, it's, you don't know. And I will say this as a person who's living it, my least concern is why, but more on how. How do we get every day? How do we get to a normal sense of living? How do we make sure that as caretakers we're healthy in the now, but also on the research end of how do we prevent this later? One of our online viewers, that's the yellow card, aren't we creative? The question is, what does marijuana do to brain health? How does marijuana affect brain health?
That's a great question. And that was from someone in the cloud out there online. Okay. There you go. So we get that a lot in primary care. Everybody seems like they want to get on the CBD oil, on all of these things. When
edibles,
gummies. Edibles, gummies, all of these things. We know that if someone is using the drug grade level of marijuana, that certainly can have some cognitive impact. It can slow your processing. It's an addictive product, and in many parts of the country, it's still illegal. So I discourage that. I talk that. It's one of the questions. I used to not ask it. I ask it more and more among, especially my college age and adolescent patients, if they're vaping, if they're using marijuana, other tobacco products. And I warn them, if they're in college and they're really wanting to do well and excel, I say, well, you probably should think about cutting back on your marijuana use, because there's good data to suggest that it's slowing your cognitive capabilities.
And what about the other, as you mentioned, the edibles, the oils, do you put all of that in the same category with brain health?
Yeah, I don't know the correct answer to that. I don't know if Dr. Day has another opinion about that, but I discourage all of that.
Yet another area where we need some really dedicated and well-designed studies. There are some that are in development to try to address that question about edibles and very specific formulations of CBD that's removed, some of the chemicals that lead to the mental clouding or the high that we put with that. I have made decisions in partnership with my patients before where they tell me that this really helps my sleep and my anxiety, and therefore the next day I'm functioning better, and we're not seeing any harm or impairment. And so I think there is room for that one-on-one decision making, but we're not at a point where we can make with any comfort level sort of a blanket statement about what people should or shouldn't do when it comes to some of those medical derivations of THC, CBD, oils, edibles, all those kinds of things.
Okay, thank you. We have another question that is asking, is there a relationship between dementia and Parkinson's?
So this is where I guess I'm relieved I mentioned Lewy body disease before. So it's got a funny name that we don't always know exactly what that we don't talk about it as much as we do Alzheimer disease. But Lewy bodies are a buildup of a different protein in the brain. When those proteins build up in the movement disorder center and are really only in the movement disorder center, that's Parkinson's disease. So Lewy body diseases include Parkinson's disease. When those Lewy bodies spread, which they can in people who have Parkinson's disease, they can move to other areas of the brain and they can disrupt function in the other areas of the brain, and that can cause changes in memory, in processing, visuospatial function, and sometimes hallucinations, distortions in the world around us. And it's at that stage that we call that a dementia. And so Parkinson's disease, which is a movement predominant disease, shaking, tremor, difficulty with walking, over time in many people can evolve to include cognitive changes and a dementia. When we think purely about Lewy body dementia, what we're talking about there is a similar disease to Parkinson's, except instead of those Lewy bodies building up in the movement center, they start in other areas of the brain. And so that the symptom that those patients present with are usually changes in thinking, hallucinations, some big fluctuations, ups and downs, who can then maybe later develop Parkinson's disease. So there's definitely a connection. We're working on treatments for Parkinson's disease as well for these Lewy bodies. And so again, goes back to having the right answer, sort of knowing what's the cause of any changes that are present, because that's going to direct what line of research you might want to be thinking about, and of course the treatments that are available to manage symptoms.
Thank you. Does the disease seem to affect one gender over the other?
So depends on which disease we're talking about. First off, none of us are spared. So all genders, all people are affected by the diseases that we're talking about. Alzheimer's disease is more common in women than men. And the reasons for that aren't just as simple as, well, women live longer than men. So I think there's more to that story. There may be a role of some of the female hormones in this disease as well. Some of the changes, particularly that happen after menopause, might increase that risk. But maybe in some ways we also haven't managed all those risk factors as well as we should in women and men. And so getting back to all the differences, the disparities that exist, there's disparities related to race and ethnicity. There's also disparities related to gender, access to education, opportunities, all of these sorts of things that we've seen great progress in, but we haven't completely closed the gap. And so we do think of Alzheimer's disease as being more common in women. Parkinson's disease is more common in men, and maybe that relates to other types of exposures, environmental toxins. Head trauma is linked to Parkinson's disease, and so that might explain some of that difference there as well.
Thank you so much for that answer. How does MS correlate with these diseases that we're talking about?
These are all great neurology questions, so I'll keep going as long as you'll host me. MS is what we mean multiple sclerosis. It is an inflammatory disease of the brain, more common for symptoms to begin in the 20s or 30s, affects more women than men. It's an autoimmune disease where essentially the body attacks the brain and leaves scars. So that's the sclerosis, and typically multiple of them. Can affect the brain, can also affect the spinal cord, and can cause various kinds of disability related to that. The treatments for multiple sclerosis have improved incredibly over the last decade. It's an enormous success story in neurology and in medical research in general. And so with treatment and prevention of those plaques from forming, people with multiple sclerosis are living longer with less disability and less risk of dementia. There are cognitive complaints that go with any disorder that leaves multiple scars in the brain. And so I think that's why it can be a relevant topic when we're thinking about dementia, but it's not a common cause of dementia when we're seeing patients who don't have a history of multiple sclerosis.
They told me your mic is dying. I have a question from an audience member that states that they were a caretaker for their loved one and eventually had to have them put into a rehab center. And they just want to know if you can share some suggestions on how to care for loved ones when you can no longer care for them at the home.
Sure. Often it happens that the level of care the person requires is more that can be provided at home. There's no gold standard. Everybody's resources are different. But when that time comes, one way of looking at it is as the family primary caregiver, you don't need to do everything any longer. So you start looking at quality of what you do as opposed to quantity. So when the person was at home, you did everything. You prepared meals, you may help with feeding, you did the laundry, you did the cleaning, you planned the day, you gave the medicine, you did everything. So a person transitions into whether it's rehab, skilled nursing, memory care, the family primary caregiver no longer needs to do everything. However, there are probably certain things that you are always going to do better than anyone. For example, you may know what your loved one favors for a certain meal. So maybe you decide you're going to go every day and spend lunchtime there to assure they enjoy that meal or they don't get something they don't care for. You may decide you want to continue to do their laundry because there's a certain scent of the wash soap that you use, and you think that may make them more comfortable. You may decide you want to go every Wednesday afternoon because there's a sing-along, and you've always liked music together. So I think the difference, and we talked a little bit about not having guilt, we have to recognize our own capabilities. So if a person transitions from home into long-term care, there's still plenty of things to do. But again, think of it as a quality thing you can do, something that only you know, something that's going to be more appreciated from you than from a professional carer.
Just to add to that, Francine, that was a beautiful, beautiful response. But it prompted me to think that as a primary care provider, I've actually experienced a shifting in my mindset over the last couple of years, largely to influence from one of our other neurologists and palliative care doctors who you guys saw share a story, Dr. Maisha Robinson. And she's taught our team in primary care at Mayo a lot about the value of early introduction of palliative care. A lot of times I think we think of palliative care when somebody's really at the less than 6 months of life to live, less than 3 months, where they're really thinking about going on to hospice or in this context into an advanced memory care unit type of situation. But she's been telling us and encouraging us as primary care doctors to have conversations with our patients earlier on in the process. If somebody has a diagnosis of Alzheimer's and if it looks like it might be progressing rapidly, to start to have those conversations earlier than later about defining goals. What would be the families and the individuals' desires for if and when we get to that stage. Having those conversations, I think, earlier in the process is very important. There's a lot of stigma about palliative care, which I think has done disservice to our community and harmed our community, because when those times come, a lot of times we're unprepared for it and we don't have the resources in place that could have been put in place much further upstream. So just an encouragement and a plug for having those conversations earlier in the process with the care team to really define what those goals are.
Okay, unfortunately, this will have to be our last question because we have to get ready for our breakout classes. But this question is, what age does dementia generally begin? And do you believe that there will be a universal cure for it one day?
Getting in the way of day-to-day activities. The typical age for a diagnosis of dementia is over 65. And so we refer to that as late onset symptoms, but really in the medical community we mean that's a pretty typical time where we're going to see that. However, you've already given us an example from your own family that the 50s are where we start to see that risk beginning to creep up. We think of it as in our 60s, about 5% of people could receive a diagnosis of dementia, or 5% of the cases we're going to see are going to come from the 60s. In the 70s, that's up to 25, 30%, and it continues to escalate from there. The actual changes in the brain, though, what we've learned through the studies that we do, typically studies with normal people who are invested and want to learn about the brain and help answer these questions for the future generations, show us that the early changes of diseases like Alzheimer's begin 20 years before the symptoms emerge. And so that knowledge, which is pretty new knowledge, something we really have gained over the last 10 years, informs how we're approaching our research and designing studies now. It means that if we want to intervene and we want to prevent, we're going to have to do that in the 40s and the 50s. And so there's a new and renewed emphasis on recruiting and engaging people earlier. We've made a lot of investments in working with our older individuals, 60 and up. And now we've got to learn, what do we need to do to engage people in the 40s and 50s? And for those in that age group, for those that have been in that age group, we know it's a complicated time. You're probably wearing many, many hats. Husband or wife, mother or father, supporter, employee. You've got your parents aging on one side and your kids growing on the other, and now you've got a couple of researchers or a team saying, why don't you come in and spend 8 hours with us doing a thorough assessment? So we've got to bridge that gap. We've got to find ways to engage people where they are being involved in the community. We're open for feedback and suggestions for that. I personally do think we are going to develop a cure for many of the causes of dementia. And I think we're going to do that really through these strategies that emphasize prevention in the same way that we work to prevent breast cancer, prostate cancer, colon cancer, heart attacks by treating cholesterol and diabetes early on. I think that's going to be the best strategy that we have as we try to cure these really difficult, really disabling disorders.
Thank you so much. Thank you all for this first part of our session. Now, if I didn't get a chance to ask your question, you can go to one of the breakout sessions and ask your question directly to the person that, based on what you've heard, you think will be able to answer that at best. Dr. Day, Dr. White, and Ms. Francine will each be doing breakout sessions in which you'll have the opportunity to go between the multiple classes. Ms. Francine's class session will be dealing with caretakers. And of course, we know our two great doctors here are going to be answering your medical questions, but it will be a more one-on-one. You'll be able to ask your direct question that is dealing with your direct situation. What we'll do at the end of this is our assistants out front are going to come and direct you to the classes because they're going to be on the back side of our church. So you'll come up here and they'll lead you to where you're going. I'm going to ask our table panelists if you can go ahead and start heading to your area so you can get ready. If we have someone that is attending the session and you're not able to do the stairs, that's okay, because our amazing ushers out there are going to be able to take you to the elevator or the ramp to the side. If there is if there is someone who is not going to be able to stay for the breakout session and you have a particular question that you didn't get answered, they can give you the website out front where you can email that question and they will answer you directly. Thank you so much for joining us today. I know it's graduation season and people are really busy, but I think you all will agree with me that this has been very helpful. It's information that we need in our community. I want to encourage each of you here and those that are online to share this information with someone. One of the other things that my sisters and I have experienced is people are in denial. And so because we live this, I can smell it in the room. I go visit someone for, go to their parents' house, and I immediately know that these are signs. But it's such a sensitive topic, you can't just say, hey, do you know your mom is showing signs of dementia? Or, you know your dad is, So platforms like this will help, because if that person is in denial and you don't know how to have that conversation, if you can get them to just watch today's platform, listen to what the doctors are saying, then maybe that will make them start paying attention and doing the necessary things that they need to do to get their loved ones some help. So thank you so much. Cynthia, are you here? If I can have our ushers to come front so you can help guide everyone that's going to the sessions where they're going. And the classes, for those of you who are familiar with Bethel, the classes are in the historic dining room and the round room and the toddler area.